So my name is Tanyo Benson. I'm a clinical faculty at SNHU. I've been there for basically 3 years. November 8th will be my third anniversary. And I'm going to be doing a presentation on generalized anxiety disorder. I happen to have generalized anxiety disorder, so this is something that hits pretty close to home, and it's under the mental health. So I was diagnosed with general anxiety disorder in 2021, and it's kind of a hit and miss for the last 3 years, where I get panic attacks from time to time, depending on what is going on. So what's anxiety? Anxiety is a normal feeling of fear, dread, and uneasiness. It might cause you to sweat, feel restless and tense, feel like you drank a lot of coffee, and a rapid heartbeat. It can be a normal reaction to stress. For example, feeling anxious when faced with a difficult problem at work, before taking a test, or before making an important decision. Some people may have anxiety for, maybe going on a date or voting for seeing who's going to win the elections in the next 10 days or so. GAD, generalized anxiety disorder, usually involves a persistent feeling of anxiety. So this is not just, there's normal anxiety, which is, it happens, everybody has that, but general anxiety is something that um, is a little bit more pungent and more, I use this picture that you see here on the right side to demonstrate or to illustrate what generalized anxiety is. So this interferes on how you live your life. It's not the same as normal anxiety that everybody has. It's actually a little bit stronger, and it could literally, make your life a living hell, as it's been for me for the past couple of months. But um, it usually develops very slowly. Generalized anxiety disorder can affect children and adults. The condition often begins in childhood or adolescence, but may begin at any age. In my case, it began when I was in my 40s. So um, there is still data out there. There's still questions, I should say, out there whether it was caused by genetics or whether it was caused by the corona vaccine or whether it was caused by a previous work that I used to work, a previous job I used to have. So there's not really a way of knowing exactly what it was, or it could be again genetics. Maybe I was predisposed to it. Women are twice likely as affected to have GAD as men. Generalized anxiety disorder is common. It affects about 3% of the population, of the adult population, that is. Um, Childhood anxiety occurs in about 1 or 4 children, and sometime between the ages of 13 and 18. However, the lifetime prevalence of severe anxiety in children ages 13 to 18 is approximately 6%. So I mean, maybe you could say not a lot of people have it, but it's still, if you like a 3% of 330 million, that's still a pretty big number in terms of the US population. The exact cause of GAD is not fully understood, although it's likely that a combination of several factors plays a role. Causes of GAD may include genes, kind of what I said, inherited from your parents. Maybe you inherited a recessive gene or dormant gene, and a history of stressful or traumatic experience, which was my case with work, previous job I used to have, domestic abuse, hostile work environment, childhood abuse, or bullying. The main symptom of GAD is excessive and persistent worry about everyday things. This is something that I sometimes go through. I get a little bit nervous about what I'm going to do next, or what like for instance, this presentation, I was a little bit nervous. Am I going to perform well? What's going to be the consequence of the upcoming elections? What's going to happen if I travel to a different country? These are kind of things that I worry about from time to time, and that could cause problems. People with GAD have trouble controlling their worries or feelings of nervousness, and often know that they worry too much more than they should, which is true. Symptoms of GAD may fluctuate from time to time, depending on the level of stress that one's going through. Um, Symptoms include restlessness, feeling on the edge or irritable, being easily fatigued, shortness of breath, heart palpitations, difficulty concentrating, muscle tension, headaches, muscle aches, stomach aches, and difficulty falling asleep or staying asleep, which I tend to have from time to time. So insomnia, definitely is one of those symptoms. It's important to note that occasional anxiety or worry is a normal part of life. So everybody has anxiety at some point. Many people worry about things such as health, financial issues, family problems, but people with GAD feel extremely worried or nervous more frequently than the average person. So it's not just the average worry, it's a little bit higher than that or more intense than that. So in terms of treatment, there's various methods of treatment. Drug treatment, this is called selective serotonin reuptake inhibitors, or SSRIs, and the serotonin non-epinephrine reuptake inhibitors, SNRIs. SSRIs are the most commonly prescribed antidepressants. They can erase symptoms of moderate to severe depression, which can be linked to anxiety, because when you get anxious and you sometimes have, or at least in my experience, have hopelessness of where is this ever going to end? So that causes depression. So SSRI examples include citalopram, which I've taken before. It may cause insomnia, which is not very good. Prozac, which I'm sure a lot of people have heard about, but it takes about 4 weeks to actually start seeing the effects. Paxil, this is very good for sleeping. And Zoloft, which I'm sure some people have heard of, also takes about a month before it takes effect. I've personally been on both Prozac and Zoloft, and I didn't really see much of a difference in terms of my anxiety. The side effects of it: nausea, vomiting or diarrhea, headache, drowsiness, dry mouth, insomnia, which is a very big deal, nervous system agitation, dizziness, which could also be problematic, like vertigo. I didn't experience that. From my case, I experienced mostly insomnia. Sexual problems, erectile dysfunction, and impact on appetite, leading to weight loss or weight gain. So you could either eat less or eat more, depending on the circumstance of how your body responds. SSRIs may also increase your risk of bleeding, especially if one is taking other medications, such as NSAIDs, non-steroidal anti-inflammatory drugs, aspirin or warfarin, and other blood thinners. So SSRIs, fortunately, are not addictive, but stopping them abruptly could lead to withdrawal symptoms, nausea, dizziness, lethargy, flu-like symptoms, and general feelings of uneasiness. So when you stop these, you have to consult with if you feel like you want to stop these, you have to consult with your doctor and make sure that he or she tells you what process, how to proceed with, and it's usually a gradual process to wean off of these medications. Serotonin and non-epinephrine reuptake inhibitors, SNRIs, they're a class of medications that are effective in treating depression. SNRIs are also sometimes used to treat other conditions like anxiety disorders and long-term chronic pain, especially nerve pain. So they could serve two purposes. Examples include Cymbalta, which I was on. Again, it takes about a month for it to be effective. I personally didn't get any relief from that. And Effexor, which I'm currently on, which has helped me with treatment of my anxiety. And then Fetsima. Side effects of SNRIs, similar to the SSRIs: nausea, vomiting, dry mouth, constipation, fatigue and drowsiness, dizziness, excessive sweating, and sexual dysfunction. Other effects of the SSRIs, SNRIs, include the serotonin syndrome, which is potentially life-threatening situation. It results from having too much serotonin. There's always a saying, too much of a thing is not good. Serotonin syndrome is rare, but it can happen when you take a new SNRI, an increased dose of multiple medications that act on the serotonin system. The syndrome also happens when you take an SNRI in addition to other medications. So always tell your healthcare provider which medications and supplements you're currently taking before starting a new medication. I personally have been on some supplements, but they didn't really work. I was on copper, zinc, and I can't remember the third one, but those personally for me didn't help. Sometimes it helps for other people it helps other people, but personally, it didn't work for me. I did take anxiolytics. There are a class of medications that aim at treating patients with panic disorders and GAD and other uses. Buspar, I haven't taken that, but I've heard some good news about it. It's an anxiolytic, so it used to treat chronic anxiety and panic disorders. It's not habit forming, which is a good thing, so you don't get addicted to it. But you need to take it for a few weeks before being able to see any kind of results. Benzodiazepines. This is where my current problem kind of existed. I was taking benzodiazepines. They're central nervous system depressants. They raise levels of amino acids in your brain called GABA or gamma aminobutyric acid. GABA blocks other activities in your brain, which helps you feel calm and makes you feel sleepy. And I said this was like something that I take clonazepam. There's others that I've taken, but I take clonazepam, and I got off that pretty quickly without proper medical advice, and kind of led me into a all-day anxiety situation, which I currently experience. But I've been able to have less things, over with therapy and with other medications. I've been able to minimize the effects of it, but it's still there. Barbiturates, these anxiolytics work like benzodiazepines. So benzodiazepines, you can get addicted to them. And the thing about benzodiazepines is your body could easily adjust to them or adapt to them, and then you have to increase the dose. And so you may end up, finding yourself taking 10 milligrams of benzos, and that's pretty hard to weed off of. Like, you'd have to really weed off of it slowly if your intention is to weed off of them. Low doses can ease mild to moderate anxiety and give you a relaxing, calming feeling. They're short-term medications because they're habit forming. Barbiturates include amlodipine, pentobarbital, and phenobarbital. Non-benzodiazepine drugs, Zolpidem is very good for sleep. That's Lunesta. Propanol is a beta blocker. That's also good as well for non-habit forming medication. So short-term side effects of anxiolytics can include slurred speech, low heart rate, low BP, irregular breathing, memory loss, confusion, depression, dizziness, faulty judgment, nausea, and nightmares. The only one that I felt from taking benzodiazepines and other drugs was dizziness, and also sort of like needing to sleep or needing to, sort of feeling fatigued. Long-term anxiolytic use can also cause side effects like mood swings, aggressive behavior, vision problems, sleep problems, brain problems, liver damage, which is very important, very problematic, sexual problems, and chronic fatigue. So with withdrawal, this is very important. When it's time to get off anxiolytics, your doctor might still be tipping off your dose. So consult your doctor. It's because if you suddenly stop taking them, it could be fatal. It could lead to seizures, confusion, restlessness, anxiety, and insomnia. Some drugs like barbiturates can cause life-threatening withdrawals if you suddenly stop taking the medication. So that's why I kind of highlighted this. Is very important to consult with your doctor before you get off these medications, so they can slowly leave you off of them. So some other meds, pregabalin, can be used for treatment-resistant anxiety. Cannabinoids, medical marijuana, may be legal in your state. In Florida, it's legal. I personally tried them, but they're not for me because they give you a high that is not pleasant. Antipsychotics, Seroquel, I was on that for a couple of weeks, and then also Abilify. It's also a mood stabilizer. This could also help with your anxiety. Mood stabilizers, the most effective mood stabilizing drug is lithium. The problem with lithium is that you might end up gaining weight. So that's sort of the issue with that. Besides taking medication, Seeking a therapist is also helpful. Psychotherapy can also be helpful. Cognitive behavioral therapy is the most effective form of psychotherapy. Um, it's the most widely used therapy for anxiety disorders. Research has shown it to be effective in treatment of panic disorders, phobia, social anxiety, and generalized anxiety disorder, among many other conditions. So most of you have had a BetterHelp. That's just one avenue you could take, but there's also uh, other therapists that you could see in your area. Dialectical behavioral therapy is an evidence-based model of therapy that helps people learn and use new skills and strategies so that they can build lives they feel are worth living. EMDR, or eye movement desensitization reprocessing therapy. I've tried that before. Frankly, it didn't work for me, but it may work for some people who have experienced a lot of trauma. This method involves moving your eyes in a specific way while you process traumatic memories. EMDR's goal is to help you heal from trauma or other distressing life experiences. Ketamine, I've also tried this. Some places you have to do 6 doses, um, you have to go there 6 times, so to speak. And it's an IV. It basically targets your synaptic receptors in your brain to mediate the brain's response to stress and formation of traumatic experience. If misused, ketamine could cause death. Some of you may have heard of the Matthew Perry death from friends. He used excessive amounts of ketamine. At least that was also reported. So it's not something you want to use without proper supervision. Aesthetic ganglion block. This is also something that I've tried. For me, it only worked temporarily, but it's an injection of local anesthetic to block sympathetic nerves located on either side of your voice box in the neck. An injection of these nerves may reduce symptoms such as pain, swelling, color, sweating changes in upper extremity, and also can be used to treat PTSD. Neurofeedback, something I also tried but wasn't very successful at it. It's a kind of biofeedback which teaches self-control of brain functions to subjects by measuring brain waves and providing a feedback signal. It also helps you determine your level of concentration on things, on what, like in this case, what you're watching on TV. It can aid in retraining your brain on how it reacts to anxious thoughts. Transcranial magnetic stimulation, TMS, I also tried this. It's a procedure that uses magnetic fields to stimulate nerve cells in the brain to improve symptoms of major depression. It can also be used to treat anxiety. This wasn't successful for me, but I tried it anyways. Just a general outlook on GAD. It's possible to live well with GAD if a person gets professional treatment, very important. Practice relaxation strategies, actively works towards changing negative thoughts, very important, and engages in a healthy lifestyle and habits that minimize stress. So that concludes my presentation. I will leave the floor open for any questions or comments.
Wow, I couldn't believe all those medications that you explained so thoroughly. A lot of them they all sound like they're all interrelated with the central nervous system, I would assume, in the chemical response. Did you were you aware of their physiological responses or what they did physiologically before you were on them, or did the doctor kind of give you some information about it, or you just kind of did some research on your own to kind of go over to kind of understand how the meds work?
I did research on them. I especially look for drugs that would focus on treatment-resistant anxiety. And pregabalin was one of them. Effexor was another one. So I'm currently taking those to sort of help me out. And they've been, compared to where I was 6 months ago to now, it's definitely been better. But what I've noticed is that my anxiety is mostly based on mood, based on thought process. So when I wake up in the morning, if I think about anxiety and if I ultra focus on it, like I did this morning, I become anxious. But if I don't think about it, if I don't focus on it consciously or subconsciously, then it doesn't exist. So it's something that kind of comes and goes depending on the circumstances. Like when I go to the gym, I use the steam room, I use a jacuzzi, I use a swimming pool. My
Yeah.
anxiety pretty much is almost non-existent because I'm in a safe space, so to speak, and I don't
Yes.
feel it. But once I get out of that safe space and I come home and I start to think about it, then it starts to sort of, it could go from a 1 on a scale of 1 to 10 to a 6 or a 7.
Oh my goodness.
Fortunately, more recently, it's, like before I went for treatment at a facility in Ocala, Florida, it was about a 5, and I used to feel it mostly in my stomach. But after the treatment and with the medications that I've been taking, it's gone down to like a 2.5. So it's become a little bit more manageable as opposed to
Yeah.
before, where it was 90% of my thoughts were on anxiety on a daily basis. It was miserable. It was a miserable existence.
Yeah.
But now I don't think about it as much, but it's still there. And I've been dealing with this um, for about a year. The other 2 years, I wasn't taking. The main reason why I got into the situation I did was because I stopped taking the benzodiazepines very quickly, and I'm supposed to weed off of those, and that's kind of what caused this all day anxiety. Um, but
Yes.
um, yeah, but basically, with the treatment I received, when I went to a treatment center, and with the medication I've received, it's kind of calmed it down a little bit. But there's still work to do. I still have to stop getting anxious about every little silly thing. Like, oh my God,
Yes.
who's going to win the election? Oh my God, how's my presentation going to go? Oh my God, if I, like when I'm on the roadways, I make sure that when I'm moving from the right lane to the left lane, oh my, I get a little bit panicked to
Oh
make
my
sure that
goodness.
there isn't a car that's, like your blind spot. There isn't a car that's trying to get into that is in the lane that you want to transit into, and that you don't want to get into an accident. So little things like that could trigger me, and just thoughts about the future. Um, what could happen if I lose? What if I lose my phone? What if this happens? What if that happens? So all of those things are sort of worries that I have. But what I've tried to do is I've tried to, through the therapy and the treatment that I received um, when I was at the treatment center in Ocala, I have learned to sort of redirect my thoughts, my anxious thoughts, to more positive thinking, so I don't end up catastrophizing and then end up falling into the same situation that I was in. But again, overall, my anxiety has definitely gotten better, but it's still something that I have to deal with on a day-to-day basis. I don't have that
Yes.
same sort of feeling in my stomach, in my gut, where it's there. It's like a 5 on a scale of 1 to 10. Now it's more like a 2, 2.5, 1.5 on a scale of 1 to 10. So it's dialed down a bit, but I still have to work on not getting intimidated, not getting flustered or worried about, again, things that I don't have control over.
Yeah,
So
sure.
yeah,
Wow. Thank you, Tony. That was a very thorough and informative presentation. Thank you for
yeah.
sharing. It was great.
Or Kimberly, I don't know if you can hear us, but do you have anything to add or any comments?
Yeah, maybe she can't
Yeah.
hear you or something.
Okay. I'll take that. Okay. So yeah, it's a journey that it's the most difficult thing I've ever had to deal with my entire life, besides
Yes.
getting my doctorate. My doctorate will maybe number 3 or
Yeah,
so.
yeah.
Um,
Sure, I can
but
understand that.
yeah, it's a process, and um, it's definitely something that people actually kill themselves over, but that's not something that I'm looking at doing. but it's definitely something that people that could be very, very problematic and could be very detrimental to one's physical health because it could affect your sleep cycles. Like my sleep cycles, I sleep fairly well, but for some reason I always wake up at 4 o'clock in the morning. I can't go back to sleep. So that's something that I'll have to talk to my psychiatrist about. But
Yeah.
yeah, and I recently found out that I have a cousin that has sort of the same symptoms. So I think it might be a genetic thing where somehow my genes got activated at a certain point in my life, and that's what's causing me to feel the way I feel.
Yeah.
Um, I inherited it from because one of my uncles also had some mental health issues, but it wasn't anxiety. But there's a possibility that my mother was carrying the recessive gene for anxiety, and somehow it got passed on to me. So thanks, Mom.
Mhm.
Rest in peace. She's passed away, but you know, or there's also the possibility that it started from the coronavirus vaccine. Again, I don't know how. I haven't found any more. I haven't found research on that supports that, but it is also a possibility. There's so many different possibilities that it could have happened. Kimberly, do you have any comments?
Can you hear me?
Yeah, I can hear you. We
Yes.
can hear you. Yeah.
Oh, okay. I had to adjust my sound settings. I'm sorry.
Are you a
So
student or are you a faculty?
no, I'm a student actually. I'm a brand new graduate student in the
Oh,
MPH
really?
program. Yeah, this is
Okay.
week 2.
Oh,
So
good to meet you. What
yeah,
class are you? What
I'm
classes are you
in
taking?
Dr. Skeen's class for Principles of Public Health.
Oh, Leanne Skian?
Yeah,
Oh, I
yeah.
wish she was here.
Yeah, I'm in her
Okay.
class, but I just wanted to say thank you for your presentation and for sharing your story. And I wondered if you had tried any type of meditation, mindfulness, and or yoga to kind of help with those, those anxious feelings to kind of center yourself and ground yourself.
I actually had gone to a hypnotherapist
Mm-hmm.
and it kind of worked for the time being, but it's too expensive because my insurance doesn't cover it. It's like $200 a session.
Yeah.
And he does help me rest a little bit, but um, it's not something that has really been effective. I mean, it was effective at the time. I also saw I spent probably about $5,000 overall on different techniques and stuff. I even went to see a doctor, a wellness doctor, and they prescribed me these vitamins and zinc and copper supplements, but those didn't really seem to work either. It's my anxiety is very mood oriented or thought oriented, I should say. So, like today, for instance, I was at a gym around 3, 4 o'clock. I started feeling very nervous, but then when I went to the swimming pool and I swam and I went to the jacuzzi and I went to the sauna, the anxiety went away. So it's very mood oriented, depending on and thought based. So depending on what I'm thinking of. Right now, I don't feel it because I feel like this session is actually kind of therapeutic,
Mm-hmm.
talking about it. But later on or tomorrow morning when I wake up, I might think of it, and then over time it starts to, sort of cultivate itself, and then it becomes problematic to where I
Yeah.
start feeling very uncomfortable.
Well, the
And
exercise,
yeah,
the exercise releases endorphins, and those are
yes,
those positive stress, those positive hormones, right?
yeah,
So it really kind of counteracts the cortisol with the stress hormones.
yeah.
So I would just, I find yoga really beneficial. I have anxiety myself,
Oh, really?
yes,
Do you
mine.
have do you have do you have is it GAD, generalized anxiety, or
Uh, well, I've not. My doctor just calls it anxiety disorder,
okay,
and I take Celexa and am very well controlled with that. And then I have Xanax for breakthrough panic
okay.
attacks. But I do practice yoga and meditation, and I find both of those really helpful.
Oh, really? Yeah, I do. When I go to bed, I put on there's Rain the rain, I go
Mhm.
to YouTube and I put on the rain, even though in Florida it rains, but it doesn't rain. It doesn't rain as long as I want it to.
Yeah.
And Christine can speak more about that, but it doesn't rain. So I have a YouTube thing where I go on and I just put on the rain and I listen to the sound, the drops of the raindrops. And it helps me sort of sleep and relax. But then all of a sudden at 4 o'clock, I wake up like today and I'm just like, oh, what's going on? Why am I waking up at 4 o'clock in the morning? And so my anxiety is, I don't know how yours is, but mine is, it's hit or miss and happens during the process of the day. Typically it's like a sunrise sunset situation. So it's probably the highest around 2 or 3 o'clock in the afternoon. And then in the evening, it slowly starts this to go down to the point whereby it becomes uh, negligent. So like right
Mhm.
now, I don't feel any anxiety. And again, maybe it's because I'm talking to you guys. So I don't know if that's similar to how you feel, Kimberly.
Mine's pretty constant. Like the last, which is why this Alexa is pretty effective. It keeps it very well controlled. But like these first 2 weeks of school, while I'm really excited to be in this program, I've also been
Mhm.
super anxious about my assignments when I submit them. Like, oh my God, did I do everything that I was supposed to do? Like, did I understand it correctly in the rubric? Like all of that stuff. So like I'm really anxious for the feedback to come so
Mhm.
that I know I'm on target, and mine manifests itself that way. So yeah,
What if you don't mind my asking, what medication are you taking any medication for it
yeah, I
or
have
therapy?
Alexa,
Okay.
and yes, and I have a therapist who I've seen for
Okay.
years.
Okay. Yeah,
Yeah.
I have a therapist that I'm seeing. But again, compared to last year or compared to the last 6 months, my anxiety now is definitely way better. I was at a treatment center for about a month in a place called Ocala, Florida, which is not so far from Orlando. And I had therapists that I had to talk to, and then medication that I was given. And it didn't seem like it was really, I felt a little bit better there, but it was kind of boring because there was, we'd have our classes from 8 p.m. to 3 p.m. And then after that is like nothing. So I go to the gym, which kind of helped. But then the rest of the evening, I was kind of just sitting around doing nothing.
Mm.
But once I got out of that treatment center, and my problem is, like I kind of laughed, joked at it. I was like, the people I saw there had worse problems than I did. Drinking, alcohol, substance abuse, heavy depression. And somebody even asked me once, like, what are you doing here? I'm like, I'm here to get better because, it kind of, in a ways, it kind of put things in focus because when I looked at the fact that people that my peers had worse problems, and again, not saying that mine was less, but looking at some of the problems that these people had with substance abuse, alcohol abuse, it kind of made me feel a little bit better about myself that my problems weren't as big as theirs. So,
No
but
comparative suffering.
yeah, yeah, suffering is
Right?
suffering.
Yeah, that's right. Exactly. And
Yeah,
your problems
yeah,
are valid, and you know,
yeah,
we
yeah,
don't
yeah,
we try not to compare them in my house.
yeah,
No,
yeah,
no
yeah.
comparative suffering. Everybody has their own issues that
How do
all.
you, if you don't
Yeah.
mind sharing, what do you think your cause of your anxiety is?
Um, well, I think you mentioned earlier, I mean, it's genetic, right? It runs in families.
Hmm.
So, I mean, my father was very anxious. I think when I became a parent, I started to become more anxious, and that was,
Hmm.
my oldest daughter is 20 now, so that was a long time ago.
Hmm.
So, but I definitely started to notice that I became more anxious when I was a parent. And over the years, it's just progressively kind of gotten a little bit more intense, I guess I would say, to the point
Hmm.
where, a couple of years ago, I was like, okay, like I'm going to try some medication and see if it can be better. And luckily for me, I mean, it worked. And I was like, oh, I didn't know life could be like this, where my brain was actually a little bit quiet as opposed to always running through a litany of worries.
Yeah.
Yeah. So I think, it runs in families. I mean, both of my daughters have anxiety.
Oh, that sucks.
Yeah, their father has anxiety too, my husband. So, I mean, so there's definitely a genetic component.
So it had nothing to do with a work or traumatic experience that you can think of, vaccine.
I don't think so. I think I came by it naturally. I do think that life impacts it, though. I mean, work can be very stressful, and that can make us more anxious, and just whatever's going on. I mean, life is busy and things happen, and that can trigger the anxiety. So I think it's environmental. I think it's probably a combination of all of those things.
Yeah.
But I can't point to a specific trauma or anything from my past life where where it was, all of a sudden I was an anxious person. Like, I think it was always there, and it just progressively kind of became more intense.
Yeah, I mean, but your medications are working. At least what would you say how would you rate your anxiety now?
I feel actually pretty good now. I mean, I have this one assignment left that I need to do a lot of work on before Sunday, so that I'm a little anxious about. But but overall, otherwise, I'm feeling pretty good.
Okay, that's good. That's good to hear. Yeah, I mean, I had, like probably earlier on, I had suicidal ideation because of just how horrible it was. But as time has gone by, I've gotten better, and I feel like with therapy, and if I just try to not let it defeat me, I would be better. Like if I put in the time and effort and said to myself, don't let this, and I even have some videos that I've recorded, to sort of help me out to make sure that I don't, to keep me in check. So it just depends on circumstances. So,
well, and I really think therapy is a game changer as well. I mean, I that's been really, really beneficial for me over the years. And, I will just say, I use the techniques I've learned. Like, I do that self-talk, right? Like, when I was kind of freaking out at the beginning of week 2, because last week was pretty easy. This week, there's a lot of work. And I was kind of freaking out a little bit about that. But then I was like, one assignment at a time, Kim, one assignment at a time, right? So just using that self-talk is really beneficial too. You talk you just like what's real, what's not real, right? That is one of the anxiety techniques therapists used with my kids when they were littler. So what is real and what is not real? And just kind of going through that, right? When you're thinking about your worries, what's a real worry, what's not a real worry, right?
And have you heard of fear? Fear is false evidence appearing real. I don't know if you heard the acronym. Fear, I'm going to put it in the chat. It's that's what my therapist told me. It's false evidence appearing real. It's almost like it's a way to sort of tell yourself, hey, what you're feeling is not real. It's not false evidence. It's nonsense. Don't let it take a hold of you. So that's something I've learned. Fear, the fear acronym, false evidence appearing real.
Oh, that is actually really great. I had not heard that acronym before, but kind of this.
That's what my therapist taught me. Yeah.
So what's real, what's not real.
Yeah.
Good. Well,
all right, Kimberly. Well, thanks for coming to my session. I appreciate it.
Absolutely.
And I wish you success.
Thank you.
You're going to be PH? That's what you're doing right now?
Yes, that's the
Okay,
goal.
good. All right, maybe I'll have you in one of my classes. I teach PhD 540 and 610. So maybe I'll see you in one of my classes.
Maybe, I hope.
Yes. Okay.
Okay.
All right,
well,
Kimberly,
you
have a good
great
evening.
weekend. Thanks,
All right,
you
take
too.
care.
Bye-bye.